The breast or the pad structure located on the anterior thoracic wall in the pectoral region. They are present in both males and females, yet they are more prominent in females following the puberty. In females, the breast contains the mammary glands, an accessory gland of the female reproductive system. The mammary glands are the key structures involved in the lactation. In this article, we should look at the anatomy of the breast, their structure, innervation, vascular supply, and any clinical relevance. Surface anatomy. The breast is located on the anterior thoracic wall. It extends horizontally from the lateral border of the sternum to the mid-axillary line. Vertically, it spans between the second and the sixth costal cartilage. It lies superficially to the pectoralis major and the serratus anterior muscle. The breast can be considered to be composed of two regions. Circular body, largest and the most prominent part of the breast. Axillary tail, smaller part, runs along the inferior lateral edge of the pectoralis major towards the axillary fossa. At the center of the breast is the nipple, composed mostly of the smooth muscle fiber surrounding the nipple. This is a pigmented area of the skin termed the areolae. There are numerous sebaceous glands within the areolae. This enlarged during the pregnancy, secreting an oily substance that acts as a protective lubricant for the nipple. Here we can look for the surface anatomy of the breast. Note that the axillary tail has not been labeled in this diagram. Anatomical structure. The breast is composed of the mammary glands surrounded by the connective tissue stroma. The mammary glands, they are modified sweat glands. They consist of a series of ducts and secretory lobules. Each lobule consists of many alveoli drained by the single lactiferous duct. These ducts converge at the nipple like spokes of the wheel. Connective tissue stroma. The connective tissue stroma is the supporting structure which surrounds the mammary gland. It has a fibrous and the fatty component. The fibrous stroma condenses to form the suspensory ligament of the Cooper. These ligaments have the two main functions: attach and secure the breast to the dermis and the underlying pectoral fascia. They separate the secretory lobules of the breast. Pectoral fascia. The base of the breast lies on the pectoral fascia, a flat sheet of the connective tissue associated with the pectoralis major muscle. It acts as an attachment point for the suspensory ligament. There is a layer of a loose connective tissue between the breast and the pectoral fascia, known as the retromammary space. This is a potential space often used in the reconstructive plastic surgery. This is the internal structure of the breast. Vasculature. The arterial supply to the medial aspect of the breast is via the internal thoracic artery, also known as the internal mammary artery, a branch of the subclavian artery. The lateral part of the breast receives the blood from four vessels: lateral thoracic and the thoracosacromial branches. They originate from the axillary artery. Lateral mammary branches, they originate from the posterior intercostal artery derived from the aorta. They supply the lateral aspect of the breast in the second, third and the fourth intercostal space. Mammary branch, they originate from the anterior intercostal artery. The veins of the breast correspond with the arteries draining into the axillary and the internal thoracic veins. Here we can look for the lymphatics. The lymphatic drainage of the breast is of the great clinical importance due to its role in the metastasis of the breast cancer cell. There are three groups of lymph nodes that receive the lymph from the breast tissue: the axillary node, the parasternal node, and the posterior intercostal node. The skin of the breast also receives the lymphatic drainage. One is skin that drains into the axillary, inferior deep cervical, and the infraclavicular nodes, nipple and areola. This drains into the subareolar lymphatic plexus. The five groups of the axillary lymphatic nodes, all groups drain into the apical node. Nerve supply. The breast is innervated by the anterior and the lateral cutaneous branches of the fourth to sixth intercostal nerves. These nerves contain both sensory and the autonomic nerve fibers. The autonomic fibers regulate the smooth muscle and the blood vessel tone. It should be noted that these nerves do not control the production and the secretion of the milk. This is regulated by the hormones prolactin and the oxytocin, which are secreted from the pituitary gland. Here we can look for the clinical relevance of the breast cancer. This is the most common type of a cancer to be diagnosed within the UK. After the lung cancer, it has the second highest death rate due to the cancer. It is more common in the women than men. Common presentation associated with the breast cancer are due to the blockage of the lymphatic drainage. Excess lymph wells up in the subcutaneous tissue, resulting in the clinical features such as a nipple deviation and the retraction, and prominence gain between the small dimpled pores. The larger dimples are generally caused by the cancerous invasion and the fibrosis. This causes the traction of the suspensory ligaments, causing them to shorten. Metastasis commonly occurs through the lymph nodes. It is most likely to be the axillary lymph nodes that are involved. They become stony hard and fixed. Following this, the cancer can spread to the distant places such as the liver, lungs, bones, and ovary. To assess a suspected breast cancer, a triple assessment is carried out. This involves a clinical examination, imaging using a monogram, an ultrasound scan, and finally a biopsy. The staging of the breast cancer uses the IIV system or the tumor node metastasis. The surgical treatment with the adjuvant radiotherapy is the recommended treatment option. The operation is local and aims to remove only the affected tissue area. Failing this, it is considered that a mastectomy is the best option. Adjuvant chemotherapy is also known to improve the survival rate. Here we can look for the mammogram. This is the left side, the normal breast appearance. In the right side, we can see the breast lesion suspicious for the malignancy. Thank you.